Good morning and welcome to The View from Lona Ridge. I'm Leona Rocha, and in the studio with me today is my co-host, John Dietz. John, I'm pronouncing that properly, am I not?
Not really.
Oh,
it's Dietz.
Dietz.
But down through the years, there maybe 50% of the people who know me always say Dietz, and I've never corrected them.
Oh, well, you can correct me anytime.
It's Dietz, but
Dietz.
But I answer to both.
Well, you're so kind, I have to tell you. And John is the owner of the KEWE radio group, and also in the studio with me is Rebecca Armato, who, if you listen to and you should have listened to our last show, because we did talk about the Pacific Cancer Institute, and Rebecca is the administrator of the Pacific Cancer Institute. And she talked to us about the facility. She talked with us about the equipment and how advanced we are in the technology here on Maui. And that for me was inspiring. I actually went to the facility. I was so impressed, and this is the reason I asked Rebecca to join us. Rebecca, welcome, and thank you for joining us again.
Thank you.
When people get the diagnosis, I've been blessed. Me personally, I have not been diagnosed with any of the cancer, but many people have. What's the reaction? Is there such a thing as normal reaction?
No, I don't think. However, the general reaction is just shock. I think anybody that's gone through that, you're just in shock. The word itself of cancer is so daunting, and it used to be a death sentence long ago, or people perceived it as such. So you just don't know where to turn. And as many times, and the reason we try to get the information out as much as possible is people are kind of half listening unless they have a family member themselves that have recently been diagnosed, but you don't really pay attention until it happens to you. And so that's the problem of they are in shock, so they're not thinking about all the questions that they should be asking. There's some great information out there on websites with a list of questions to ask your doctor when you're diagnosed. I recommend to anybody print them out and take them with you so that you get all your questions answered.
Talk about websites for just one.
Sure.
Could you give us your website, please?
Sure. It's
for anybody that wants to get more information on the Pacific Cancer Institute. This is the website.
Sure. It's www.pacificcancerinstitute.com. And we are located right next to the emergency entrance at the hospital here on Maui. I have been there for over 25 years. And we do have links to resources for people because the idea is to not just consider, generally you go to a medical oncologist because that's kind of the point of primary care in the oncology world. And it's important to understand what type of cancer you have or your family member and stage, and then knowing what your options are for treating it, because you want to attack it full on. I don't care what age people are. The important thing is every day we're blessed, and we want to make sure that people can have the highest quality of living and come out the other side healthy and happy.
And that's where education, again, education. There's a term that education. What is it? Education is expensive, but try ignorance.
I hadn't heard that, but that's a good one.
And indeed, if there is anything that you should be involved with, is your health. Mm-hmm. And so getting as much education as you can, and it's available. It's not like, you just have to go listen to one person. You're suggesting they go and talk to as many people as possible.
Yeah, I mean, and the medical oncologist does know about the other treatments, so it's important to ask. I mean, we all know being close to familiar surroundings and friends and family is important during a stressful time, and sometimes you're not the one with cancer, but you have to be the advocate for the person who does, because they're kind of in a shock state. And it really depends on the type of cancer, the age of the person, their health status, and all the different options. And so asking, is it just a chemo or hormone therapy? Is it just a surgical solution? Should we be augmenting it with radiation treatment and other kinds of treatment? We have a dietitian that talks with patients about how to eat and adjusting their diet depending on the type of cancer they have. We have patient care navigator that helps them through all the resources here on the island. There's a tremendous group of resources here for patients going through, giving them rides if they don't have a ride. We have a lot of homeless patients even. So they're treated and diagnosed, and we see all patients. We don't have, we don't turn anyone away based on their insurance or ability to pay. The
That's
idea
terrific.
is
That is terrific.
we want to help everyone.
If that to me is the epitome of the aloha spirit, isn't it? Isn't that what we're all about here on Maui and certainly in Hawaii?
And we want to help.
We care.
We want to help people understand that even though we know and have read in the paper every day about all the things going on at the hospital, our Pacific Cancer Institute is an independent facility. We are not financially or contractually, we're not part of the hospital. And so we want everyone to know that we're committed to continuing to provide care here on Maui, even though there's a lot of activity going on or disruption or confusion around what the hospital services are. We are freestanding and are able to continue to treat patients with radiation therapy with our radiation oncologist. And so we just want everybody to know that we're here. We're not going anywhere.
Well, I tell you, as you were talking, I couldn't help but think about Dr. Baker, who was the one that originated this, how many years ago?
23 years ago when he got the certificate of need.
And surely he's going to go to heaven.
And he's not there yet. I want to say, that even though he's not around as much as he used to be, and he's taking some well-deserved time off, he's still actively involved with our center and with Dr. Fallett.
If we can sign a petition to help to get him into heaven when he's hopefully not ready for a long, long time, but he certainly made a lot of lives a lot easier here on Maui. So we don't have to go to Honolulu. We don't have to. We can stay with our family. Just finding a place to stay in Honolulu. The facilities are, I know my husband was at Queens, and I had to stay with a friend. The only choice was to stay with a friend. There was one little facility that they had, and it was easier for me to stay with a friend.
Well, and the challenge with radiation therapy is that you have to do it over so many days, depending. In most cases, again, the type of radiation you get from us depends on the location and type of cancer you have, but generally for most situations, whether it's skin cancer or prostate cancer, you're coming every day, Monday through Friday, for 5 to 10 minutes to be treated. And it is you give radiation over time. And so the idea is if you're coming every day, whether it's 4 weeks or 5 weeks, 5 days a week, you can't fly over. It's not practical to go over Oahu. And we don't want people to not get it because of that reason. That was why Dr. Baker fought so hard to get the equipment and the certificate of need to be able to build this facility here.
A lot of people are worried about that aspect and are afraid because, oh my, I'll have to go to Honolulu, I'll have to go over and over again, and that's kind of the partially reason for pulling back and really dealing with the reality early, because you don't really want to put yourself through that transition of having to go over and come back indefinitely.
It's costly. It's costly.
Yes.
And disruptive, if you will.
Well, and again, it goes back to it's important to have your family around you when you're fighting this, because your state of mind and your support team is important.
One other thing, which has nothing to do with the treatment itself, but it has to do with parking.
Hey, we have great parking. That's what's so nice.
I don't mean to take you off on another tangent here, but I have to tell you, when I went there, the parking was amazing. I could park. I didn't have to pay for it. And I had maybe 25 feet or so. I walked into this wonderful facility. So so for starting from the parking aspect, it made my life a lot easier.
Well, the thing is, we do have reserved parking right outside the door, but primarily that's because patients that are coming to us are also getting chemo or are very sick, and so we've worked with the hospital to make sure that it was simple and easy for family members to bring their their family member with them, whether it's a wheelchair or whatever.
Certainly,
to bring
you can see that is. You mentioned chemo. Can you do radiation the same time you're doing chemo?
Yeah, you can have. We work very closely with the medical oncologists and the chemo. So a lot of times patients are coming over to the hospital for their chemo and then coming over for radiation. But we coordinate it with the chemotherapy so that the patient, it has the greatest bang for their buck on the fighting the cancer, but also simplifying their life and helping facilitate the coordination of that.
They can do both.
Yeah.
They can do both. And we know how devastating chemo in many cases can be to a human being. Yes, and it's necessary. But radiation doesn't hurt, does it?
Well, it depends on the type of cancer. I will say I can never say never. You've got that whole disclaimer thing that says, is there pain? Because depending on where the cancer is, so skin cancer on your head, it may you may lose some hair where it's being treated, based on the type. But generally, in most cases, it is the side effects are tolerable, I'll say, based on what we've seen from other types of treatment. We do have a dietitian from the Pacific Cancer Foundation that's in our facility, too, that sees patients that are going through chemo because a lot of times they have that loss of appetite. You don't have that with radiation, in most cases. So unless it's right in the throat, the tumor's in the throat, you're dealing with something.
And that's important because all the national media, whenever they do a story about somebody helping out, it's always the most dire looking circumstances. And it again causes fear among people who should get treatment, should get tested, and won't because the video that's always put out is so frightening.
Yeah, and unfortunately you're right. People won't get that it is generally covered by all insurances. So the idea is throw everything you have at it early on. Don't wait till it's way too late and nothing can be done. Getting radiation treatment doesn't make you radioactive. That's the other fear. Or saying that, gee, I can't hug my wife or kissing, whatever. We get all kinds of questions. The idea is you're not radioactive. It's much like getting an X-ray, and you generally don't feel it. It's painless. It goes away when it's done, when we turn the machine on, and only targets the tumor or the skin around where the tumor was removed, whatever we're treating, and then it's done. And so the idea is you can come in, be treated, go back to work.
You mentioned the skin cancer that not necessarily have to be operable. They can possibly use radiation for it.
We say anybody that is diagnosed with skin cancer in what I call the Bermuda Triangle, between the nose and the mouth, and the face, you don't necessarily, moles may not just be the only answer because you can have radiation and have it attacked without having somebody cut into your face. So radiation is a non-surgical treatment. It's good for all skin cancers, but specifically the face where nobody really wants a cut on your nose or your cheek.
You mentioned to me when I went through there, and I do want to say this because I'm a veteran myself. I've been in the Army, and Rebecca made it very clear to me that they have a program for the veterans. Can you tell us a little bit about that?
Sure, and we want to, and we'll be meeting with the veterans hopefully soon to talk about it, but prostate cancer, unfortunately, there's a high incidence of it, and so there are programs that we want to work specifically with veterans to get them in, get them treated properly and quickly, and help them understand that they don't have to go to Oahu for anything. They can get it right here.
Well, I just had occasion to talk yesterday with Colonel Lloyd Sototani, who is pretty much the VA person here, the veteran here, the Korean War, and I spoke with some of his people there, and he was thrilled to hear that you have something. He did ask me, and I'll say this because I'm going to ask you whether now or later, he wanted to know whether you had a tour that you could you possibly get a group of people, veterans, to come in and take the tour and educate them as to what is available, and certainly we owe them, the veterans, a great deal.
I'll work with him to set up an open house, and I'm happy to do it with any public groups out there. So
terrific.
Just have them call me. PacificCancerInstitute.com.
That's it. I'll get it. Listen, I'll take care of that one. How much time do I have, John? John. Do I have to say goodbye at this point? Oh. Anyway, Rebecca, thank you so much for joining us. Wasn't she wonderful, John?
Absolutely.
And
Oh,
you
you
know what,
guys-
John? You did pretty good job, an excellent job.
Thank you for having
He's
me.
smiling at. Thank you, everybody, for joining us. Until the next time, from the view of Lona Ridge, I'm Leona Rocha. Goodbye.